Hello, I'm Dr. Tara Tobias. I want to welcome you all back to this channel. In today's home exercise tutorial, we are going to go over ankle contractures, specifically the muscles in the back of the lower leg, which are the ones that are the most susceptible to developing contractures. And I'll talk a little bit more about what a contracture actually is, just so that we're all on the same page, as well as some of the most common treatments that people are currently doing to treat this condition. Some of them effective, some of them not so much. So I will give you my opinions on what I think are the most effective methods to treating a contracture after any type of damage to your brain or your spinal cord. But before we dive into that, if you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so you get notified every time I upload new videos. And now let's go ahead and dive into the content of today's video. So first and foremost, what is a muscle contracture? And a muscle contracture is basically just when the muscles and the soft tissue around a joint have adaptively shortened, causing a loss of range of motion or the available motion in any specific joint. As I had mentioned, today's video is going to be just on muscle contractures in the muscles that point the foot down, because those are the muscles that are the most susceptible to developing a contracture. Now, I want to differentiate a contracture from spasticity. Spasticity is an involuntary contraction of the muscles that point the foot down. That is a little bit different. A lot of times they do coexist, primarily because if spasticity is left to persist, it will develop into adaptive shortening of the tendons that point the foot down. But just to be clear, they are two separate conditions. So there are a variety of reasons why these muscles are prone to contractures after a stroke or a brain injury or when you're living with MS. As I mentioned, one of them is spasticity. The other one is a lot of times there is weakness in the muscles that lift the foot up, so the foot doesn't actually dorsiflex, so it just stays pointed all the time, which causes those muscles to adaptively shorten. The other reason is because when we are in bed for a long time, we have blankets on our legs, our feet just stay pointed. So that's another reason why you can develop contractures in these muscles after a stroke or a brain injury. And the other reason is from lack of standing. So when we do stand and bear weight on our legs, it automatically flexes the foot. When you're not standing and you're primarily in bed or in a wheelchair, that foot is left to stay pointed if you're not in any type of bracing. And that is another reason why you could develop contractures in the muscles that point the foot down. Now, for any of you who are in the early stages, or you are someone that has a family member that is in the early stages right now, let me tell you, once a muscle develops a contracture, it is extremely challenging to regain not just active movement in the ankle, which is where the muscles on the front of the leg can actually lift the foot up again, but even passively to get that foot flexed so that you can stand. So this is a topic I'm extremely passionate about, and I feel like a lot of people neglect this early on, either because it's painful or you're not standing or you're focused on getting your arm movement back, but this does get neglected quite often, and it is very common for contractures to develop in these muscles. So again, if you're in the early stages, do not neglect your stretching. It is so important. Now, what else can you do to prevent this from happening if you are in the early stages? Stand. A lot of people are fearful, especially if you have neglect in the early stages after a stroke or a brain injury, and they may be hesitant or resistant to stand or get mad at family members when family members ask them to stand up. But I can't stress it enough. You do not want to develop a contracture, and so standing is one of the best things you can do to prevent that from happening. The other thing is bracing. Sometimes this gets missed, especially if someone isn't walking yet. Usually bracing comes into play a little bit more once someone starts walking. But if you can, and you're working with a physical therapist, I always think it's best to get a brace early And then you can always modify it as your mobility progresses. So maybe now they can do something where they make a solid AFO or an ankle foot orthosis, and they can pre-articulate it so they can actually make a brace that can be articulated down the road. I've done a whole video, done several videos actually on bracing, but I will link in the description the most recent video I did on this. But you can, even if you're not standing yet, getting a solid AFO just to maintain that ankle's motion is extremely important. In addition to that, a night splint, a good night splint. If any of you saw my post this past week, I am right now in the process of getting one on my website that is going to be available for sale in April. I have scoured the market, trust me. I have bought every single one I can find on the market that is considered off the shelf. And I'm specifically talking about a splint that you wear at night to keep the foot flexed. So remember I talked about the sheets, and that's a reason why you can develop a contracture. Having a night splint on at night in the early stages when you don't have a lot of active movement in your ankle is extremely important. I have bought every one on the market, and I can't find one where the heel does not slide up out of it and or the straps slide. So there's not one on the market yet that I've found that keeps that foot flexed and gives you that prolonged stretch. And so again, it will be available for sale in April. If you haven't yet signed up for my newsletter, definitely sign up for that, because as soon as it's available, I'm going to be sending an email out. So there's a link in the description for the newsletter. In addition to that, I just send out weekly emails just to keep you motivated and kind of keep you on track with your home exercises. But in addition to that, you guys will be the first to know when it is live on my website. So those are the ways to prevent a contracture, but what are the methods to do once you've developed a contracture? And just like preventing it, probably the most important things that you can do and the most effective things you can do are a good stretching program, standing, a good night splint, making sure that you're working with an orthotist that can make you a brace for walking that is comfortable, that you will wear, and I mean wear during all of your waking hours. I have had more patients than I can count on both hands that I assumed they were wearing their brace outside of therapy, and come to find out they were just putting it on in the car before they came into therapy. That is no good. Even if you're sitting, if you have an AFO, you really do need to wear it. Most of the time, if you're in a wheelchair, that foot flops off the end of the foot plate and your foot stays pointed. The more your foot stays pointed, the more chance there is of that muscle adaptively shortening, and you will not get that range back. If your foot stays pointed, it makes it harder to get your foot into a brace, and it definitely makes it harder to walk. So even if you're not walking yet as your primary mode of getting around, you still want to be wearing that brace during the day. If it is uncomfortable, that means you just have to have a conversation with your physical therapist and the person that made the brace. I promise you, they are on your side and they want you in a brace that is comfortable. So be open with them, especially be open with them if you're not wearing the brace outside of therapy. So again, stretching is very important. Bracing is very important. A night splint is extremely important. Weight bearing, even if you're just standing, you're not walking yet, I would be standing every day, multiple times a day, working on your comfort of getting over onto that foot. I've done a ton of videos to walk you through a step-by-step progression to slowly increase the loading that you're putting on that leg. Extremely critical component of the rehab process that needs to start as soon as possible. Most hospital systems do have a protocol where physical therapy starts really early after a stroke or a brain injury. So in most cases, if you are in a hospital that has a neuro program, you are standing. But the difficulty is you've got to maintain that into rehab and into outpatient, even if it's painful, because I promise you it's going to be more painful once you develop a contracture. So I know it can be a little bit painful early on, as well as just scary early on, but work with your therapist on that. Be open with them about some of your concerns, some of your fears, your pain, things like that, so that they can help you come up with a plan that you are comfortable with, that you can carry over when you're not in therapy. And then the last topic I want to bring up, really just because it's been coming up more frequently down here in Florida, are soft tissue releases. I am not sure why these are becoming more common down here, but they are, and it's very concerning to me. So a soft tissue release is basically where they go in surgically, you get put under general anesthesia, they go in surgically, and they surgically lengthen that tendon. Now, there are several reasons that this is concerning. One, when you're under general anesthesia, I think, and I'm not a medical doctor, so I could be wrong, but in most cases, you do have to go off your blood thinners, which puts you at higher risk for having another stroke. You have a hospitalization, which increases your risk of infection or getting something while you're in the hospital. You're being cut open, which also puts you at risk for having an infection. And after surgery, your mobility is limited until that area heals. So I do understand that it is a quick fix, and I think that's why a lot of people jump to this. But with all these other conservative treatments, it's really just concerning to me that people are jumping right to these soft tissue releases, knowing that in most cases, there were things that people weren't doing before surgery to prevent that contracture from happening. And so in most cases, you might, again, not be totally compliant with those things that could have prevented that contracture. And so it is going to come back. If you have the soft tissue release, it's just the way that the soft tissue structures in the body work, and your foot stays pointed again after this surgery, there is a good chance that's going to come back. The other thing is, the only thing that a soft tissue release is indicated for is to lengthen a tendon that has adaptively shortened. There's no literature that I have found where this is the ideal treatment or the most effective treatment for someone with spasticity. In most cases, if you have a contracture in these muscles, you do have spasticity in your lower leg. This will not cure spasticity. So I've mentioned it in other videos, there is no cure for spasticity. So that involuntary pointing is going to continue to happen even after a soft tissue release. So I included it in this video because it is a treatment for contractures in the lower leg, and it is becoming more common after a stroke or a brain injury. I just don't necessarily think that it's the way to go. I think you've got a lot of other options that you can do. There's also something that we call serial casting, which isn't used as much anymore, but they actually cast your leg and then leave that cast on for a while, and then you periodically go back and they keep recasting your leg, slowly getting that range back in your ankle. Non-invasive, non-surgical, no general anesthesia. Yes, that is probably a last resort, the serial casting, because you do need to keep going back in to someone that can cut the cast off and recast you. So it is not the easiest method, but even that I would recommend before someone went in and got a soft tissue release. So I hope that was helpful. And final thoughts. Don't get discouraged. I know that it is painful to do these stretches, but when you're comparing surgery to doing the stretches and doing the weight bearing, I know it's going to be uncomfortable, but don't forget, surgery is uncomfortable, and that post-operative time after surgery is painful. So I hope you can kind of keep that in mind when you are doing some of these stretches that are going to be painful. Again, if you haven't signed up for my newsletter and you are interested in this splint that I promise you is the most durable one on the market, and it is the only one that can adequately keep your foot positioned to get that stretch back in your ankle, definitely sign up for the newsletter. The link is in the description below. If you haven't yet subscribed to this channel, hit that subscribe button, turn on that notification bell so that you can get notified every time I upload a new video. I enjoyed spending time with you all today, and I will see you all in the next video.